3, 2, 1. Good morning, everyone. Nice to have you here today. My main objectives today are to describe the evidence of common patient meanings of cancer-related pain and to state the meanings that influence some outcomes in patients with cancer-related pain as reported in the literature. The guiding principle of this presentation is that what pain means to a person with cancer can determine their pain experience and pain outcomes. My focus today is on patient meanings of cancer-related pain, not family, caregiver, or clinician meanings of pain, although these are in their own right important sources of information. Meaning is an abstract concept and difficult to describe. Medically trained clinicians are not usually on the lookout for meaning when treating their patients. So I think a simple way to understand pain meaning or meanings of cancer-related pain is to introduce the idea of two fictional patients who each complain of mild abdominal pain, and both patients, Sue and Peter, both rate the intensity of this pain as 4 centimeters on a 15 centimeter VAS. Peter has a history of dyspepsia and attributes his abdominal pain to having just eaten. He rates the unpleasantness of his pain as 3 centimeters on a 15 centimeter VAS. By contrast, Sue has just been diagnosed with stomach cancer. She is extremely anxious about the future consequences of her abdominal pain, and she rates the unpleasantness of her pain as 8 centimeters on a 15 centimeter VAS. Sue and Peter have similar intensities of pain, but different pain-related cognitions and emotions. One source of the difference between these fictional cases is that Sue's pain has a different personal meaning than Peter's pain. What then about the meaning of meaning? What is it? Well, there is no consensus in the literature on the meaning of meaning, but its basic denotation is association. For example, learning the use of a word, chair, in connection with an object is a form of association. Association enables the child learner to adapt its behavior to cultural or societal norms. This normatively shaped behavior is important in learning subsequent and more sophisticated associations. Applied to pain, when a child learns the word pain, it acquires a symbolic way of telling what is going on, which develops into grasping more complex sentences about pain. Meanings build slowly over time, are context dependent and culturally determined. Natural language is arguably humankind's premier tool for articulating meaning. In the psychological literature, cognitive appraisal theories emphasize the evaluation of a situation to determine its meaning and one's response to it. According to Lazarus, 1966, personal meaning is the product of an individual's appraisal of an event and his or her own coping resources. In stressful or ambiguous situations, Appraisal involves evaluation of the level of perceived threat to personal well-being and evaluation of personal resources to manage or cope with that situation. According to Lazarus, the more ambiguous are the stimuli cues, the more important are general belief systems in determining the appraisal process. Now, cancer is an ambiguous disease. The disease is of unknown origin. Its course is unpredictable. The likelihood of managing disease is uncertain, and the pain created by cancer or by the cancer treatments is often vague and diffuse. As a result, some patients with cancer become withdrawn. A person with cancer can become sensitized to, continually monitor, and preoccupied with pain and other bodily sensations. Some bodily sensations serve as a constant reminder of cancer or perceived reminder of cancer and are capable of being viewed as pain, leading in some patients to overreaction or even panic. Pain to some patients with cancer-related pain can mean cancer or disease progression. In one study, Arles, 1983, observed that 61% of patients with cancer-related pain viewed it as meaning progression of cancer disease. 39% reported that they had not thought or considered this particular meaning. Patients who viewed pain as meaning worsening cancer had significant increases in depression and anxiety. Most patients, well over 70%, did not remember receiving any information about the source or expected course of their pain from healthcare providers. Some cancer patients may see increased pain as meaning medication failure, with possible consequences for mood and adherence to treatment protocols. In some patients, there could be a disparity between the patient's interpretation of mean, the patient's interpretation of pain, and its actual meaning. Knowledge about the origin of pain can determine pain experience and pain outcomes. In this study, Price et al., 1987, patients with cancer-related pain were distinguished from patients with labor pain through higher VAS unpleasantness than sensory ratings. The reverse was true for labor pain patients. In patients with cancer-related pain, unpleasantness of pain was enhanced by meanings that extended beyond sensory pain qualities, including the thoughts and images they had about the tumor location and the future consequences of having this particular type of pain. In contrast, labor pain often has an immediate positive meaning that a baby is being born. Positive meaning of having a baby could offset the unpleasantness of labor pain during the pushing phase. Beliefs about the origin of pain can differentially influence pain ratings in patients with cancer-related pain. In this study, Smith et al., 1988, the ratings of pain, both before and after physical therapy, by patients who believed that cancer was directly responsible for their pain, were compared to the ratings of pain by patients who ascribed their pain to other factors, such as the effects of their treatment and or a medical condition other than cancer, such as arthritis, and or they were uncertain about the etiology of their pain. The grouping in the study was based on the patient's belief in the etiology of the pain. Smith et al. Found significant group differences in response to the pain-increasing physical therapy. Patients who believed that cancer caused their pain, believers, rated their pain, their present pain intensity significantly higher following physical therapy than did those who ascribed their pain to other factors. The pre to post increase in pain intensity after physical therapy was marginally greater for believers than for the others. Finally, the believers in this study also rated their pain effect after physical therapy as significantly higher than the others, but the pre to post change in present pain effect between the two groups was not significant. The two groups also did not differ significantly in ratings of positive or negative mood after physical therapy. There is evidence of the effect of specific meanings on outcomes in outpatients with advanced cancer and cancer-related pain. In a 1991 study, Barkwell used Dapowski's categories for meaning of illness to evaluate meanings in outpatients with advanced cancer and cancer-related pain. The meanings assessed in the study were challenge, meaning diligence to overcome pain or a determination to improve. Enemy, meaning pain robs life of meaning and also robs life of hope. And punishment, meaning penalty for past wrongdoings. Barkwell found that outpatients who viewed their cancer-related pain as a challenge to overcome through an attitude of determination and diligence reported significantly lower levels of pain intensity and depression, and better coping with pain compared to outpatients whose pain meant an enemy or punishment. In the same study, praying, hoping, and increased behavioral activities were the most frequently used coping strategy in patients with cancer-related pain. Catastrophizing and reinterpreting pain were the least frequently used. Praying or hoping involved telling oneself to hope and pray that the pain will get better one day. For example, quote, "I pray to God it won't last long," end quote. Frequent behavioral strategies were increased levels of activities such as personal chores or personal projects, or pain-related behaviors such as taking prescribed medications. In Arathuzek, 1991, in female patients with various metastatic breast cancers and moderate levels of pain intensity and pain-related distress, the most frequent meaning of pain found was challenge. Challenge being Lepowski's meaning of illness category discussed earlier. These patients were determined to get well, overcome their pain, and achieve life goals despite their pain. They viewed pain as less threatening, with fewer concerns their pain could worsen, and as meaning less bodily harm. Related coping strategies in these patients included communication, relaxation, distraction, visualization, acceptance, problem solving, and in some patients, reappraisal. patients who continue to be active and ambulatory perceive pain as challenging or as an opportunity. It did not withdraw or become inactive when in pain. Up to 40% of cancer survivors have pain. 5 to 10% have chronic severe pain that interferes with daily functioning and quality of life. Developed by Heathcote and Eccleston, 2017, the cancer threat interpretation model is a cognitive affective model of the meaning of pain in the context of cancer survival. A survivor is motivated to believe that immediate pain is non-threatening, but at the same time, the patient could find it difficult to evaluate the pain as true from a false alarm. Cancer survival is associated with symptom uncertainty and a lack of accurate threat assessment. These patients may be at risk of anxiety and maladaptive coping. To outline some of the clinical consequences of the meanings of cancer-related pain, pain assessment. The meaning of pain has been identified as a major element in cancer pain assessment by the Oncology and Nursing Society and Sign 106. The perceived meanings of cancer pain inventory, developed by Chen, 1999, is a reliable and valid method for assessing the meaning of cancer pain and may complement the McGill Pain Questionnaire or the Brief Pain Inventory. But no quantitative summary of pain experience can capture the meaning or burden of pain for a particular patient. For this purpose, nothing is more revealing or therapeutic than a conversation between a patient and a clinician, which allows the patient to be heard and the clinician to appreciate the patient's experiences and offer empathy, encouragement, mentorship, and hope. Patients value healthcare professionals who adopt a holistic approach to care and are able to communicate about psychological, emotional, or even spiritual impact of cancer-related pain. Healthcare professionals can encourage patients to communicate about their pain and to understand it if they wish. In cancer pain settings, it could help particular patients with cancer-related pain to know that cancer-related pain can be controlled. Not all cancers cause pain. Therefore, it's important to explain to some patients the source of pain. And also in some patients, it might be important to separate meanings of pain from meanings of cancer progression or death. Sometimes patients can confuse these. Thank you very much for your time.